our services are for free, which is important. So when they come, and it can even be a relief to get in and say, okay, I'll get my services, there's somebody who cares about me, I have my next appointment. And often what we see is people, before we even start anything, you know, the prophylaxis, co-trim or the food, that they actually gain weight. And that's what I say, that people gain weight on hope and on kindness.
In all, I feel happy because I'm fully working and now at a higher level. I'm a head of department. I just now supervise teachers, whatever they are doing. Really Reach Out has helped me in many areas. My children are on school fees, operation, I get food, I get salary on top of that.
Since now I'm very strong, I'm now working with the Reach Out. I'm a translator. I feel very happy for that job. My future plan is, if I can get now, build a house for my family.
And I also thank Reach Out of what they have given us, like hope, love, especially love, because we people living with HIV, we need many things, but above all, we need love and care. Yeah.
Reach Out is only one of many service providers in Uganda. Some, like the AIDS support organization, TASO, have played a crucial and long-term role in Uganda's HIV/AIDS response and blazed a trail for others to follow.
Well, TASO has a role even beyond Uganda, because TASO was established now 18 years ago, at a time when there was a lot of stigma and discrimination and denial, and where people who tested HIV positive had no hope. So in a sense, there was no motivation to go for a test. Why test if at the end of the test there's no hope? And the founder of TASO, Noreen Kaleba, whose own husband had AIDS, saw that in the West, where her husband was hospitalized in the UK, there was still a lot of care, psychosocial care and medical care given that kept people alive, that gave them hope that there was life beyond an HIV positive diagnosis.
The Mild May Center is another comprehensive initiative that has built up extensive medical facilities.
The holistic approach to care is the way to go, where you try and meet the needs of the patients in terms of their physical needs, their spiritual needs, their social needs, and their psychological and emotional needs. And where you don't have the capacity to meet any of those needs, then you use the referral system to identify people within your network to meet the needs that you cannot meet in your facility.
Great strides have been made by many individuals and the society as a whole in Uganda to control HIV/AIDS. But even more must be done.
These are early days of a massive, lifelong operation, and I don't think anybody fully appreciates both the scale of what has to be done and what it will take in terms of revamping our health systems, which in a sense creates an opportunity. Because the opportunity is, if our health systems have not been functioning well, a massive infusion of resources, primarily directed at HIV and AIDS, could be leveraged to improve health systems. But the sustainability is going to depend on the success of the current interventions and on continued global advocacy and on partnership to make sure that health systems work.
The Rakai Health Science Program is the result of 18 years of continuous research at the very epicenter of the epidemic. In cooperation with Johns Hopkins University, the program is documenting the rural population where HIV/AIDS was first identified.
I see a new chapter opening up for HIV/AIDS care and prevention as a result of introduction of antiretroviral drugs. There is a great opportunity for us to really offer help for those patients who have HIV infection. However, These new opportunities also produces great challenges. And if these challenges are not taken on seriously, we may end up writing a different story. The challenges specifically are antiretroviral drugs must be accompanied with strong prevention programs for us not to slide back into a situation whereby people think there is a treatment and therefore they can do better, and therefore they relax their guard in their behavior.
The more open the society becomes, the more people you get seeking care. If the society is closed, many people will die in quiet corners of their houses without seeking any care. The suffering will be horrible. The disease will continue to spread. So those are key issues that need to be addressed.
Many more AIDS sufferers in Uganda than ever before are being treated, but tens of thousands still need access to antiretroviral drugs. Even so, the strategies and models that Uganda has employed to prevent transmission and to ensure adherence contain lessons many countries have yet to learn.
Today, if you know your status, you can plan for your future, you can plan for your family. If you have children, if you have relatives, you plan to them. I just tell my people, we are not sick. We are just, the difference we have, me and you today, who is negative, it's the virus which is in my blood, but we are the same.
We are not powerless against this epidemic. If we work together in a partnership, in solidarity, we can defeat it.